Hi, today we will be presenting an overview of France's healthcare system. This is what we will be covering in this presentation. So a brief overview of the French healthcare system. They do provide universal health coverage. Health insurance isn't required, and many health insurance programs are offered by the government. Government covers most costs, but patients pay co-pays and charges above covered fees. It's funded by payroll taxes, national income, and tax levies, but 95% of the residents do have supplemental insurance to cover extra fees. So a brief history of the system. In the late 1700s was the French Revolution, where there was a mindset shift that health is a human right and hospitals were nationalized. In the 1800s, there was a lot of focus on public health and development of a healthcare system. In 1920, there was the creation of the Ministry of Health with continued focus on public health. In 1930, there was the Act of Social Insurance, which was a mandatory health insurance program for workers. And then in 1945 was the National Social Security Act. In the late 1990s and early 2000s, universal health coverage through health insurance was implemented. And in 2012 to 2016, there were several acts that were implemented to improve access to care. So for country information, there are 66.8 million residents of France. The government type is semi-presidential republic. The median age is 41.2 years, and the unemployment rate is 10.1%. The primary causes of death are heart disease, cancer, and accidents. For the past analysis, we'll first look at the political section. The president and prime minister actively share the governing role. The next election is in 2027, and France is a member of the European Union. For economic, France is the 11th strongest economy in the world. Their GDP is expected to rise in 2024, though disposable income is falling due to inflation, and there are shortages in healthcare the workforce. For social cultural, there is an expected increase in 65 and older. The aging population is increasing the burden on healthcare, and less tax revenue from less workers does impact the ability to pay for the health system. For technological, France is the second largest market in Europe for medical equipment and the 6th largest exporter of medical technology. They are on the cutting edge of medical technology. They have 8 official innovation clusters that focus on biotechnology.
France governance. The key entities that governs the health system in France is Ministry of Health. It oversees the function of the healthcare system and ensures the provision of quality healthcare services to populations. The National Health Insurance Fund. It's the main public health insurer in France. It covers 93% of the French population, salaried workers, self-employed workers, and students. It's under the supervision of both the Social Security Ministry and Finance and Economic Ministry. High Authority for Health. HAS is an independent public authority responsible for evaluating healthcare products, technologies, and practice. It was established to assist France public institutions in optimizing the basket of reimbursable goods and service. The Regional Health Agency. They're responsible for coordinating population health and health care, including prevention and care delivery, public health and social care. Roles of government. The French government plays a significant role in the healthcare system, with a strong emphasis on universal health coverage and public priorities. Some key aspects include universal coverage. The government ensures that all residents of France have access to healthcare services through a mandatory health insurance system. Policy framework. The government sets priorities and formulates policies related to the public health incentives, disease prevention, and healthcare delivery. Use of new technology. The government promotes the adoption of new technologies and innovations in healthcare. France has a social justice orientation. The healthcare system is built on principle of solidarity and equity, prioritizing equal access to healthcare services for all individuals regardless of their social economic status. The government plays a strong regulatory role in the healthcare system, is predominantly funded through contributions from individuals, employers, and government. Private health insurance exists in France, but it primarily serves as a supplement coverage for services not fully reimbursed by the national health insurance. The government's focus on universal coverage and its role in regulating the healthcare system reflects a commitment to social justice principles in the healthcare provision. Coverage. In France, the healthcare system provides coverage to the population through a combination of statutory health insurance and complementary private insurance. Statutory health insurance covers 100% of the population, whereas complementary private insurance covers 95% of the population, either through their employer or by purchasing it individually. This insurance covers the remaining portion of healthcare service expenses not reimbursed by the statutory health insurance. The French healthcare system provides a comprehensive coverage for a wide range of services, like hospitalization, physician services, pharmaceutical, and long-term care. The services that are not covered are the cosmetic surgeries and treatment, some dental and vision routine, certain medication, and alternative therapies. Please note that while these services may not be fully covered by the national health insurance, individuals can opt for supplementary private insurance plans to enhance their coverage in these areas. Now we'll hear.
First, we will discuss the cost of healthcare in France. As of 2020, the latest data found, healthcare expenditures were 12.21% of GDP, which is higher than several wealthier countries, but on par with Germany and Canada. Per capita health expenditures were approximately $5,740 US, with an out-of-pocket expenditure of just under 9%. Which has been declining over recent years. This is most likely because of the agreement made between physicians' unions and the government to cap balanced billing at twice the official fee. There are no deductibles to be met in France. Cost sharing is split between co-insurance, co-payments, and balanced billing. 77% of all healthcare expenditures in the country are covered by government. France is ranked 12th in the world for healthcare performance, showing strong patient-centered care and services. Its infrastructure is solid, ranking 6th best in the world. France excels at preventing hospitalizations as well as high survival rates for cardiac incidents and cancer. The weakness of the system was shown during COVID-19, however. Their slow response and high numbers of COVID-19 transmission rates ranked them 23rd regarding the pandemic and pulled down their overall worldwide quality score. Presently, the quality improvement strategies implemented in France are adherence to transparency of results of both public and private healthcare facilities for the public. France's government wants to ensure patients are able to see and know facility healthcare indicators.
The French healthcare model has a strong emphasis on access and equity. Under access, the government provides universal coverage to all citizens and residents, regardless of income or employment status. They have access to all healthcare services, including preventative, primary, surgical, and specialist care. The government has heavily invested to expand healthcare access by expanding medical education, research, and infrastructure. The Territorial Pact for Health is a government-implemented policy to improve access in rural and underserved communities. Under equity, the healthcare model is based on the principle of solidarity. Everyone contributes to the national health insurance based on their income level, and everyone is given the same level of healthcare services regardless of income or social status. Everyone is entitled to a range of services from preventative, primary, and specialist care. The healthcare model has a strong focus on disease prevention and health promotion through a wide range of public health programs and initiatives working to improve the health of the population.
The French currently use about 45% of that tax to support healthcare services. Over the last 2 decades, the government faced significant budgetary challenges. Despite that, the French government was able to decrease the deficit from $15.2 billion in 2003 to $4.1 billion in 2016. What changed to lower the financial burden? Here are some examples of what they did. What else can France do to improve their healthcare costs? First, increase the use of primary care to improve national health and minimize medical costs. Second, create a database of all health insurance companies and medical institutions to better regulate the system. Third, reducing fees, checking the cost-benefit of various regulations, and eliminating those that provide little to no benefit will help. Despite having relatively good life expectancy and infant mortality rates compared to other European countries, France performed poorly in quality of care with a lack of effectiveness, coordination, and patient access-centered treatment. France underwent a key quality improvement reform by shifting their pay system from pay for service to pay for performance. By complying with these listed items, French physicians receive $6,330 under this adjustment. What else can we suggest to improve the quality of care? First, continue to expand performance-based payments rather than fee-for-service payments to keep providers focused on quality outcomes and care coordination. Second, create an online healthcare data platform for clinical research to improve the efficacy and integration of quality care. So what does France require to improve healthcare access? First, continue to work on the equality of geometric access distribution. Second, increase the focus on France's growing older population, particularly on access, chronic illness management, and long-term care facilities. Third, make use of cutting-edge technologies to foster more coordinated, integrated, and patient-centered services for each access point. Next, I will hand it over to Oji now.
Improvement opportunities for equity. There are wide disparities among social classes regarding medical care use in France. The distribution of health resources and medical professionals is highly biased in favor of urban areas and well-to-do regions. What is currently done to improve equity? Financial incentives are given to encourage physicians to practice in underserved areas. A reform that was introduced to address this inequity is the 2004 Public Health Act. This act said to reduce geographic and financial inequalities in access to services, including preventive care. Specific opportunities for improvement. Addressing the social determinants of health, especially social exclusion, poverty, and discrimination. Increasing funding for healthcare services and underprivileged areas, and investing in the development of healthcare infrastructure and facilities. The factors promoting and constraining the introduction of new products and services. The factors promoting are government initiatives or supports, advancement in technology, increased partnership from the private sector. And the constraining factors are inadequate coordination in the healthcare system of France, regulatory barriers, and then reimbursement policies. The product or service introduced in recent years. France is always at the forefront in terms of technology to satisfy all the needs and requirements of its vast consumer market. One product the country has introduced is Doctolib, a telehealth software. Doctolib was established in 2013 as a scheduling platform to help doctors and patients connect more easily. But it wasn't until 2019 when it experienced a major surge in users. During the peak of the coronavirus pandemic, the platform allowed users in France to find vaccination sites, pharmacies, and connect with doctors efficiently. By 2021, it became one of the world's top 3 most used medical consultation platforms. Doctolib is appealing to patients because of its simplicity of being able to book appointments directly. The rapid evolution of telehealth services has allowed patients to receive care and medical advice directly from practitioners in France with the use of Doctolib's video consultation service. Thank you.